Okay, well, I'm going to start and give a bit of an introduction and let people join in, and then people can catch up as we go along. We've got about 20 people online now, which is great. This is ODI Leeds is Open Data Saves Lives. We're working with our sponsors and our partners across the country, looking at ways in which we can share data, build tools, help people with the work they're doing around COVID-19. The way this works is it's all on one website, which you can see there. If you go to odileeds.org, it's on the front page. Just follow the link, Open Data Saves Lives. All of the notes about what we're working on is here. The data we're collecting, we're here. The tools we're building and our partners are all on that one page. So when people, hopefully as they go along, we're creating assets and resources that people can use, reuse and share. And I'm now going to just go through what people have been using our work for so far. I'm just admitting some more people to the call as we go. I don't know about you, have people got better at getting online to video calls on time, or are they getting worse? It seems that, yeah, it's quite interesting. We're going to try and finish this in 45 minutes. So it's going to be quite fast and furious. And I'm going to go through some of the highlights that have we've been working on. So in the first Open Data Saves Lives work we did, there's sort of three themes that came out. One is just about the data. Where is the data? Can we use the data? Can we share it? What do people need? And then NHSX and NHS Digital looking for definite use cases that they can use to share with their teams and build projects that work from that. So we had a really great input from the Red Cross and their vulnerability index. It's in the notes and it's on the first thing, but we've directed everyone who's been working on trying to identify vulnerable people, trying to identify where they should focus their efforts to the Red Cross work. So if you're working on vulnerability, we'd like to push you towards there. They've got a repo with all their work. They've mapped everything. It's down to postcode level, I think. So it's a really useful resource. So that was a great win from the first session of Open Data Saves Lives. NHS Digital published their 111 data about inquiries. We've given some feedback that we'd really like it at local authority level so that we can map that and make sense, because not everyone understands the geography of CCGs and health boards, and it's all, we need to make it more sensible for people. So that's going to happen this week, we think. So if you've seen our hex map of what's happening, that's going to be added as soon as we get that data. The work we've been doing with collecting use cases has generated an interesting amount of work around adding patient level data to address data and working with the service providers that are doing that. So I know in Leeds, TPP, who build System 1, I've been having direct conversations with Leeds and Bradford to try and make that the outputs from System 1 work in terms of the needs of a local authority. So hopefully that's going to benefit the rest of the country when that gets sorted out. And we know that NHS Digital are using the Open Data Google Sheet, or the Google document there, as a way of fast tracking use cases into their work and taking that on. So what we're going to do is Patrick Blake of ODI Leeds is just going to go through the data page that we've got collecting. Stuart's going to go through the new Hex Map visualization of COVID-19 data, and we're going to mention a little bit about geography and how that's hard and complex. Then Mark Farr from Beautiful Info is just going to give us a quick update from that part of the world, and also directly from a health board and also from a hospital. Then if people could just either physically put their hand up and let us know they want to make a point, or they can use the Zoom controls to put their hand up. We'll then take some calls and feedback and aim to finish at about 11:45. So Patrick, I'm going to stop sharing my screen now, and then if you can just take us through the data you've been putting together and where that is. And then we've got a couple of people that just want to join. So we've got get them in. If you want to start sharing your screen and start taking us through, that's great. Yeah.
Yeah. Is that started? Yeah.
Yeah.
Yeah. So anyone who's on the call last week's probably already seen this, but it's been updated a bit. So it's worth showing again. So if you go onto our website project page, there's a data page here. So this is kind of where we've been trying to collate all the different data sources. I'm sure you all found there's loads and loads of different data sources. We try to put together what I'd say the useful ones. So this one's worth a particular mention. It's Tom White's data source, and he's been collecting data for the whole of the UK in a nice CSV format, which is what Stuart's using for his project that he's going to tell you about in a minute. But if you click the Google Sheet here, all this data is in here, and this is open, so anyone can add to this. So if you've got any useful data sources, if you just add it to the data tab here, and we'll add it to the website. Useful for everyone. Yeah, that's about it. Okay.
You're on mute.
You're muted, Paul.
Been trying years to do that.
Do you know what? It's all around the world. How many times are people saying you're on mute? There should be a button that says a big one that you're on mute, not a little one. So if anyone's got data that they're using in Anger, if you put a link to that spreadsheet, it automatically appears on our front page as a button that people can use. If you're using our data and there's any comments, please use either the Google Sheet or GitHub to raise an issue or a comment so people can use that. And this is our attempt to try and get people to think about data as infrastructure, as a tool, not as a spreadsheet that they email to each other and they own. Now, that might sound a little bit harsh, but we know lots of examples of this happening over and over and over again. So if you use this as an example of putting the data in one place so it can be used, and obviously it's searchable on Google. So if you put ODI Leeds data COVID, you should find that. You shouldn't have to go through an email request or anything like that to get the data. One of the things that's not on there is the symptoms trackers work. We are asking all of the people on this line here to encourage, I don't know if you've seen the Join Zoe thing, is encourage them, a friendly manner, but to maybe encourage them to share that data openly. They've already said they've anonymized it. They've already said that they've paid some people to do this, or they've got a team at NAHR or one of the universities working. So there's no reason why that couldn't be published openly. We know that the NHS digital team who put their symptoms tracker online are looking to share that openly as well. So the more we can politely request that data to be shared in an open way, the more we can do with it. Imagine if that symptoms tracker was on a hex map. It'd already be useful. At the moment, it's not. So I'll probably get in a bit more trouble this week and next week around that. But we have to, if you could all join in politely to encourage those people to share that data, that'd be amazing. So, Stuart, if you would like to just go through, I'm going to share my screen on our visualization. I'm going to mute myself as well. So you don't
I should say that Hex Maps are one visualization, other visualizations are available. So Paul's going to get this up at some point. So some people might have seen some of this at the end of last week. I'd made a start. I've done a few more things. So there's now a plot for local authorities, which you can have on a linear vertical scale. You can change it to a log scale. Then it looks a bit like some of the plots you might have seen in the Financial Times and things like that. There's now a search for local authorities. So let Paul search for something. It's either local authorities or health boards or upper tier local authorities, which can be the same as local authorities, but can be different. Geography is hard in the UK. We've got a vast array of geographies in the different parts of the country. So the graph shows you all the data from Tom White's collated historical data and gives you the time since 3 confirmed cases in each area. I'm calling them areas as a catch-all because there's so many different things involved here. On the right-hand side, you get the hex map, which when you have searched for an area, it shows you that total that's on the side there, but you can hopefully get rid of it if Paul clicks on the little X, maybe. I'm not quite sure what's
Makes
happening.
sense.
Okay. So there's cases. So in Wales and Scotland, they're health boards. In England, they're upper tier local authorities, which can sometimes be the same as local authorities. But if it's a group of local authorities, then for the cases, it shares the cases between each local authority. Otherwise, they'd look like a hotspot when they wouldn't necessarily be so. And if you go on per capita, wait for Paul to click on per capita, then you get the per capita values. So in which case that's the per capita in that group of local authorities, and they've all got the same value then. So they look reasonable compared to the things around them. So you can see that South Wales and London are the worst per capita, and Cumbria in the north of England is a little bit of a hotspot, the 6 local authorities in Cumbria. I'm going to add a timeline on here as well, a bit like the Financial Times graph that they've got for different countries. If anyone has any other types of visualizations they'd like to add, if you've got any ideas, let me know. The aim of this was aimed at local authorities, because we had Tom Reardon from Leeds and someone from London, Paul can remember who exactly, asking to be able to compare how their local authority was doing, see if how they were tracking compared to other parts of the country. So that was the purpose of this. Okay, Paul, back to you. Oh, hang on, before I do, I should also say the hex map now includes Wales, Scotland and Northern Ireland, because I'm using data from there. The populations figures come from 2018 for Wales, Scotland and Northern Ireland. They come from 2020 estimates from the ONS for England. I've not found any more recent estimates for Wales, Scotland and Northern Ireland for population. I don't think they should be too different, but just there's different data from different places at different timescales, and it's quite tricky to. It's basically the best, latest picture that we can put together, as far as I can tell.
Great stuff. Thanks very much, Stuart, and the data team at ODI Leeds. If you've got any questions, if you just hold on to them or write a note about it, we're going to take some points in a second, and we're just going to get an update now from Mark Farr. Mark, if you just let people know who you are and some of your observations at the moment. You're part of Beautiful Information, which is a member of the partnership that we're working on Open Data Saves Lives. Over to you, Mark.
Thanks, Paul. And I'm off mute, hopefully. Can
you are off mute.
Yeah. Okay, so I work with Scott, who's on the call. We used to work for a company called Dr. Foster. I now work in the NHS, where I'm the Chief Analytical Officer for a big trust, East Kent Hospitals, which is the 6th biggest trust in the country. I'm also the chair of the analytics board for Kent Medway, which is basically the kind of an attempt at a gang of analysts for a region, but at a decent senior level. There's a load of stuff going on. As you can imagine, it's fairly chaotic. I mean, I've got about 100 staff, and I'm kind of redeploying myself and some of them to frontline giving out PPE. But in the meantime, we're getting asked daily for different sets of data from the centre. And of course, none of it's coordinated. That would be far too straightforward. So we've got Public Health England wants something, NHS England wants something different, the local CCG wants something different again. And those change almost every day. So they're now trying to bring in medically fit for discharge, MFFD, detox, delayed transfers of care, because the thing that people are starting to worry about over the last day or two is it's good that some of these people are being discharged, but is there enough support in the community to kind of look after them? So our daily world is very chaotic and getting asked for lots of different data sets from lots of different places. What I've started to do this week is to try and align all of the NHS organisations across Kent and Medway to create one linked data set that should service a lot of these stupid daily sit reps that we have to do, and actually becomes available for modelling then as well. So if we can create a pseudonymised patient level data set, we've actually got a lot of actuaries that have put their hands up to say they'll help us with some modelling, as long as we can agree a data set and agree how to record different types of oxygen, different types of ventilation, and so on. So it's really fast moving. It's quite exciting. The data is quite scary. I can show a couple of things on screen if you want, Paul. How long do you want before? I don't want to go for too.
No, you've got another. I think another 300 seconds.
Right. Okay. So I'll just show you a couple of things really quick. So this is an attempt to, and excuse the clunky acronym, but this is an attempt to link all of the data together. So if I come to, are you getting my screen moving? Have you got the cross? Yeah. Okay.
Yeah, we've got the cross. Yeah.
Yeah. Okay. So if you imagine here, this is me in an acute on the left. I don't know if you get my mouse as well.
Yeah.
A lot of people talk about linked data sets, but it's at a very high level, kind of sus HES type data, which is broadly when you came in, when you went home, and roughly what we did to you. It doesn't include all the clinical data below that. And then the attempt is to link as you go horizontally across the top of this matrix to linking data from all sorts of other people. And to your points about geography, what the councils are worried about is trying to get all these social carers organised. So CCG boundaries and things like that aren't particularly helpful to them when they're trying to deploy staff to go and help people at home. We're now sharing data each day with the Ambulance Trust, with the Community Trust, on any patients that have tested positive. We've got an interesting IG issue at the moment where we're starting to want to count and analyse staff, NHS staff who've come in, and that takes you into kind of quite sensitive area with IG, which we're looking at the moment. That's the sort of current challenge for us. We are also, can you see that? This is our kind of Smarties, and I'll kind of look at this quickly because this is real data. This is the amount of oxygen we've got on different sites. So these are 3 sites.
We're seeing just the PowerPoint at the moment. You might have to close that.
Right.
You might have to choose a different screen.
Yeah.
Choose your window. Yeah. Choose your window.
Okay. Sorry. So that one.
Yes.
Okay. So these are our 3 main sites: Canterbury, Margate, and Ashford. These are our numbers of cases. You can start to see down the left the types of measures that we are counting. We're starting, and it's really difficult, starting to try and count the amount of oxygen we've got, different types of oxygen that's available in different places. The other thing we've got is some analysis. So you've got a website now? COVID-19 website. Okay, so this is some analysis. We're basically trying to do bottom up and top down. So we're looking at sort of international data, looking at what sort of assumptions we might make, and then trying to model that down using these actuaries down into Kent to look at different levels of compliance, different levels of demand for oxygen and ventilation, and then starting to plot some of these graphs looking at sort of numbers of deaths compared to the demand that we've got. As you can imagine, down in Kent, the politics around this are, should we build a military hospital, Nightingale, at Detling Showground, or should we push patients up into London? And I think there's a risk politically that Nightingale in London becomes a white elephant. And I suspect that some patients will get pushed north towards it. Although what we're seeing in Kent is the north of Kent, just because it's closest to London, probably at Dartford, starting to fill up more quickly with COVID patients. So some of those may get decanted south to us and some may go up to Nightingale. But this data is so important, as Paul's religion is, because it will feed the modelling about if we put a new military hospital up, how many beds we'll put in it, what type of ventilation we'll be putting in it. And people are not used to sharing data and working collaboratively on this. I'll stop there, Paul, because that feels like about the 5 minutes.
That's great. That's really good. And I think we would it's really good because if you think about a data spectrum, what you showed at the end is things I think could be shared openly really easily.
Yeah.
And the stuff at the start about what how individual patients are being treated definitely shouldn't be shared. And the easiest way for someone making a decision around this is that if you were sharing that data openly, it makes it so much easier for other people to join in and collaborate with you, and they don't have to ask permission, which is the biggest thing that we're looking at here. Great. So if you could stop sharing your your screen now, and then what I'd like to do is bring in, is Graham Hyde there? Graham, could you just share with everyone your point around patient level addresses and how we're trying to help you with that, and then maybe we'll go to if there's anyone's got any questions, if they could either put them in the chat or we've got some questions there, and we'll go through the questions in the chat, and then if everyone's got a point, they can raise their hand either physically or on using the Zoom method. So over to you, Graham.
I think it's just a continual lifetime bugbear of mine about folk in the centre collecting data and just publishing it at aggregate level. I get the thing about open data, but actually there's some real nuggets of stuff that NHS Digital are collecting here. So they're asking people for their postcode, putting in their symptoms. So operationally in Leeds, that postcode level data might be really useful to our efforts to try and understand where demand for certain things is. So really, with appropriate levels of information governance, what is the possibility of the centre releasing that postcode level data? So I've tried to get in touch with various people, and I'm sure they're really busy, but it would just be another data set in our kind of toolbox of stuff operationally in Leeds that might add some extra stuff.
Fantastic. So as luck would have it, Dave Tarrant is on the line from ODI HQ, who are, I know, working with a number of central organisations to find use cases around, I guess, we're talking about geographic data, we're talking about people's data, we're talking about IG. How can we make this easier, and how can we make it easier for people to share? And rather than have a working session about setting up an ethics canvas around this, actually doing something. So, Dave, do you just want to give us 30 seconds on the work you're planning to do and how you can help, and how Graham could let you know what the use case you could put in front of people so that we make a difference very quickly?
Absolutely, thank you, Paul. And firstly, everyone, sorry to be a bit late to the party, as it were. Not that it's very much of a party, but you know what I mean. So at ODI HQ, we have put some, we've now devoted some people, resources, etc., to support in any way we can with this, be it putting pressure on the right people to release the right data as openly as possible. And as Paul points out, that goes across the spectrum, not just about open, but the shared data getting to the people that need it. So we will be doing stuff around supporting with the governance and trust, maintaining privacy, etc. Particularly, I've been interested in looking at the recent stuff the ICO has been putting out on how we do this in this situation. People might have seen the article from Nigel Shadbolt, our director in the Telegraph, talking about what we have to do in this situation. So anything we can do to support there, put pressure on the right people, or even support it in doing the data sharing, then we're more than willing to chip in and put pressure on there. The main focus areas that we'll be looking at in terms of making data open as possible is not just the data, but we're going to be putting pressure on people opening up the models so that people understand how this is built, what it means, what type of analysis this is trying to achieve, how it was done, what the caveats might be. Because yes, we can produce a lot of hex maps, graphs, and other things, but we need to understand what we're trying to model, what that model is trying to do, and how other people can use it, and possibly the code and the things that underpin that. We want to, as I say, support those to get people more motivated, capable and supported to make that data as open as possible. And we've also got guidance and training and tools that we are simplifying at this time to help people make those decisions about how, when, and what considerations might be for sharing data in different ways. So those are the broad activities that we're doing, but the key thing on the top of the project is we're here to help. And part of the reason for joining this call and not having something on our own website currently is that we're not here to create more noise. What we want to do is help people to cut through that noise to create benefit. So that's the main thing that we're trying to do within the project. So happy to be on the call, thank you. Happy to try and help along where necessary to put pressure on those who need it.
Fab. Messages, ODI HQ are available to help us make points and put pressure in the right place. And I think, Graham, your point and Mark's point there around, can we get the centre to get organised and stop asking unstructured questions for answering in a press conference that evening is not the best way to do that. So I'm just going to go through the comments in a bit. And I know that HQ are using the Google Doc that we've got around the use cases to help them steer their work over the next days, weeks and months. So that's great. And it's allowed them to amplify and accelerate what they're doing very quickly. And on my screen, I don't know if it's like you, but we've got Alistair Bulwood, who's next to Dave. And I think just to reinforce everyone, NHS Digital are using the use cases that we've got in our document to help them streamline their work and help them in their publishing. So I'm just going to go through the group chat we've got on the right hand side to make sure we pick these stuff up. The link to the Google Docs are in there. Dave's mentioned the stuff about Zoom. I think a few people have fallen over about the clickable links stuff. So we've got Matt from the Red Cross there. So I'm sorry, I said postcode level. You've got MSOA level for England at the moment. I'd love it at postcode level, but I'm sure we can. I'm sure that's a use case that's in your workflow. Matt, could you put a link to your GitHub repo with everything in there about vulnerability in the chat so that people can see that? And then it's just another reminder. Graham mentioned about the NHS 111 data. Alistair will tell us in a second that that's coming on Tuesday, I guess. I don't know. I'm hoping that that's going to be at local authority level and we'll have done that. Graham and Mark want me to get into some trouble. Yeah, that's fine. We can poke some of that stuff. Or Steve Blackburn from Data Mill North. I'll probably ask you to make a comment around some of the work you're doing in a second. Dr. Zhang, a local authority. So that's a definition of a local government in the UK. So if you look on our visualization and also on the ODI Leeds, if you search geography, we've got an exploration of how that works.
Just some examples. Leeds is a local authority. Aberdeen City, I think, is a local authority. Hackney is a local authority. And then you've got some upper tier local authorities like Cumbria, which consist of several local authorities in North Yorkshire. Harrogate is a local authority, but it's part of the upper tier local authority of North Yorkshire.
Yes, but yeah, in the UK we have made geography too hard, and every organisation that funds stuff chooses a different geography, I think, just because of reasons. Yeah. Anyway, we won't go on about that. Graham, the rates per total population, I think that's right. Stuart, just want to confirm that.
By rates, you mean, what do you mean?
I think it's on the hex map where we toggle between total numbers and
per capita. So per capita, it takes the total population and works out the number of cases per 100,000 in that area.
Yeah. Mark, your point there, yes, to compare Leeds and Kent, definitely. What's your point there, Mark? Farr? You're on mute.
I think you might have done it. I think you did it on the map. I was looking specifically at the graph of lines going up, a line going up for Kent and a line going up for Leeds, which is it's kind of useful as a count, but more interesting as a rate.
Yes.
So I can see the rates on the graph. I couldn't on the map, on the hex map, but I couldn't see them on the graph, but I might have missed them.
So Stuart, we have talked about rate of change as being a really interesting vector to measure.
Yeah.
What's our thoughts on that?
Add that. Could you add it on an issue on GitHub? And there's a
Yeah.
link on that page.
Yeah, we'll do.
I'm only part-time at ODI Leeds, so I am trying to get as much done as I can.
Okay.
Yeah, Mark, and then this is one of the best things about these sessions is that I think that Leeds and this part of the world could benefit from some of the stuff that's happening in Kent and vice versa. That building up local data sets, knitting them together, working out how we collaborate ourselves, and then telling the centre, say, this works, just amplify what's working already. So I think there's something we can do around sharing what's working in different places. So, and then whether it's us that help that happen, ODI HQ that helps that happen, I think there's an informal network that could be convened by somebody to help this happen. And being as radically open as possible helps that be successful as quickly as possible. So I think that's maybe one for myself and Dave to take offline, but there's no reason why Mark and Graham couldn't start talking about how they're doing it and connect. So I guess, Graham, if you could share your email with Mark and he can crack on, which would be great. Yeah, and then we'll talk about the work with Red Cross and ethnicity, age and sex, and obviously the whole point about collecting people's sex doing this, because obviously it looks as if fat old men are the most I'm oversimplifying that, but it looks as if,
as we found out, Paul, recently.
Yes. So yeah, men over 50 who are overweight seem to be affected worse. I don't know if that's something that we can work on that.
Alistair has a really good question about mapping to local authority.
Okay.
So Alistair will probably be able to explain a little bit more shortly, but basically very quickly in the chat, he has said, we have managed to produce a local authority file internally for telephony, but online only captures the first 4 digits of a postcode. Does anyone have any experience of mapping this to local authority?
So we just we're doing some digging. So 2 different systems at the back end, as ever. It's never as straightforward as you think. But we can only get the first 4 digits of a postcode out for basically the online 111 interactions. And there's a debate going on internally about how we then best map that to a local authority, which is only a few teams at NHS Digital do, because we tend to do CCG. So if anyone's got any thoughts or experience around that, that would be mega helpful. Because
Alistair, can I just clarify, by first 4 digits, is that literally the first 4 digits, or is that the out code?
It's literally the first 4 digits, is my understanding.
Okay.
So, it's
so if you're in, say, LS28,
60.
This part before
and if
this
you're in
code.
LS28, you just get LS28.
Yeah.
So I've got some experience of this. So the first problem is that postcodes don't match local authority boundaries, because obviously postcode geography is for delivering mail, not admin purposes.
Yeah.
So you could get a lookup relatively, I mean, it would probably do a job. If you want me to do that for you, I'll do that for you.
Well, cheers, Graham. That'd be good. I'll pop a call in the diary because we have a think about some of the other stuff as well. Because I think if it's just something we can do that's good enough and we can caveat it, then better to get that out. But there's
you just need someone with GIS skills to use a postcode district centroids lookup to local authority. It's a 5-second job. There's someone at NHSD that's got GIS skills, I'm sure.
Can you do it on just the first 4 digits?
Yeah.
Does that resolve to LA and that work?
It does, but it's...
you might not get a unique local authority.
No.
So it's a question of whether, if there's any way of sort of navigating those wibbles, I guess, because that's where we're getting, I'm getting stuck anyway.
Let me have a look.
There's there's also or there used to be, I'm sure Hannah can advise, there's also a postcode data set on the data mill, which states all the postcodes that are within the Leeds Metropolitan District. But as you say, if you that includes some Wakefield and some Bradford postcodes as well. But as you say, if you're just looking at the first four, parts of first four parts of the postcode, there will be bleed over into Wakefield and Bradford as well. It's not a unique, a precise science.
Yeah, and then it's a question of like, how do we deal with that? Do we just split it 50-50? Does one split across multiple? Anyone who's done that before, I don't know.
I mean, the other thing as well, bear in mind that you might fall ill, in one particular area and actually end up in a hospital, within Leeds. I don't know. It's, so it's. I think as a guesstimate, I think it's probably gives us a fair idea. I would have thought.
Alistair, and you could, like you say, you were saying 50-50. You could use the ONS postcode lookup file, which converts from postcode to all sorts of geographies. And if you worked out every 4-character postcode area and what fraction of them were in each local authority, you'd then know, say for LS20, let's say LS28 splits between Bradford and Leeds, you'd know what fraction of the postcodes split between each local authority that way.
And use that as a ratio just to assign it. Okay, cool.
I mean, maybe 50-50 or 33, depending, because sometimes local authorities, there can be 3 local authorities together, so sharing a boundary.
Okay, I'm going to chair this. It sounds like there's some great work just happened there in 5 minutes to help NHS Digital. So, Alistair, you've got Stuart and Graham and Stephen's contacts. Let's see if we can help.
You also might be able to chip in a couple of contacts, I think, for someone at Land Registry who's looked into this before, in terms of mapping those together that we used as part of the London Fire Brigade work when we were mapping postcodes into wards and boroughs and all the rest of it.
Perfect. So, right, we'll pause that now, but also we'll pick it up next week when we catch up. So hopefully people can feedback and make some progress, and we'll put it in the Google Doc as well. So Amy, if you could add that in, and we'll follow that through. There's a whole thing around in the chat going on around about different places responding to requests for data in different ways. This feels to me like a collective ask back from people working with the data to the centre to stop and think, and we make a suggestion of how that could be. Dave, is this something that ODI HQ could take on our behalf and feedback quickly to central government, NHSX, NHS Digital, and then you could be supported by the people who are working on locally to say, if we provided your data in this format, and I'm guessing that Mark and Scott would have a suggested format that's working for them, we suggest you do it this way, and then Graham at Leeds will say, yeah, that's great. We then have a suggested format that is 80% correct, and we can just, if it's wrong, we can add columns to it, rather than everyone just starting from scratch and saying we need a commission to agree a data standard before we do anything.
Yeah, absolutely. I think in terms of that, we just been talking to my colleague Ben, who could potentially offer a little bit. I'm going to drop Ben in it now, who could potentially offer a little bit of input.
Good. That's all part of it.
Local authorities, we're also going, like we've reached out to grow the use cases on a national scale, to then put that forward as we've talked to lots of local authorities who are in support of this and want this, and then put that forward as well. Ben, do you want to chip in a little bit?
Yep, I think I've just unmuted myself. So just sent an email around. We've got some decent contact at the local digital collaboration unit in MHCOG. So we're going to kind of try and link up with them, see what they've kind of noticed from a level of being able to see what's going on in lots of local authorities, and we can then try and do something to...
Yeah, perfect. So I think if Mark and Scott could share the data formats that they're pulling together for their part of the world, that you've got a suggested way forward, and rather than have a discussion about it at a meeting, we have a proposal, which hopefully MHCLG can just say, this is working, push it out, and then people can comment on that. I reckon within 3 weeks we'll have a really good, solid data structure for that.
Paul, can I just make a really quick point?
Yes.
I think we'll have that working next week in Kent. The point I wanted to make was that I think the narrative is around, as Scott said in the chat, a really, really important point. People are used to sending data off and nothing comes back, ever. All it ever does is it goes off to feed off some knobby question at 5 o'clock. But if you change the narrative to, if you send us this, if you run around today and sort this data out in SQL, tomorrow you will have locally an epidemiologically informed model, you know, in Power BI or on a website or wherever it is. And it may be something we write between a few of us, but that no one expects anything back from all the data that they send locally. So they always do it with a twisted face. Yeah.
So that's perfect. And if that was then
I think that's the troublemaking bit.
Yeah. Well, so we do a bit of troublemaking, and then also say that we need something back. And actually, there is a bunch of tools that if you send the data back, it will power. So our Hex Maps, you can imagine the whole load of tabs, which was different sets of data you could publish. The dashboards that Mark's producing for people on behalf, that could then be powered by, for every single CCG can have the same thing. And we need to put a pressure on the center to deliver. And this is not to create a PowerPoint or to create a report or a briefing note for somebody else. This is to inform people who are working and give them assets and tools. So we'd be really happy to work on that. Mark, I guess you'll be happy. And if we can give some bullets to fire for Dave and Ben, that would be great. So Mark will be up and running now. We've got our tools ready. We've done our work on the data. This could be a real radical piece of work that could benefit numerous numbers of people. So that point around actually getting something back, there has to be something in it for other people to join in. So yeah.
And what we'll do is the use cases that we get back through through the email that Ben's going to send out, we'll add to your doc, not our own. Right, so that we start to see there'll be no point creating a new one. Synergies between everything, so that people can just see everything openly.
We got that synergy, yeah. Have a Campuchuchu on me. Yeah, fantastic. Fab. So great. Jamie's just mentioned that Esri got their stuff in there, which is good. Just got to be careful on what they're selling as well as offering for free, which is always the balance. And hashtag get the data back. Yeah, like it. Open data saves lives. Get the data back. And Alistair, I guess you can help us make sure that we get the data back from NHS Digital on that.
Yeah. So I'll feed that back because I think that's something that maybe is lost. The only trying to think how I can best help. There is a bit of work. I mean, the problem is it's very high level that around how data is used and pushing that back to the public as well as organisations. So a guy called Tim Magel is leading on that. Well, so it might be worth plugging some of that into that because I think they accept it could be better. It's a black hole in some respects. So
there's no reason. So our point every time we say this is, publishing the data should benefit the organisation publishing it the most.
Yeah.
So and sharing it. So that's the point that Scott and Mark around is whatever they publish or provide has to help them the most first.
Yeah.
And once we do that, the centre. I mean, I know I'm not blaming you, but the centre will get a much better set of data if we do that. So I think there's also a point around, who knew that someone in NHS was doing a session around best use of data. There should be an open blog and it should be available on the web.
Yeah.
So we need to. There's a push around this. So we'll probably put a blog post up next week around this and some of the things we found. And apologies if it's going to be provocative now.
Go for it. Yeah.
but I think we might need to do some of that. So. We've been through the chat. We've had. Would anyone else like to make a point or a question or a join in? If you could either put your hand up or put something in the chat or use the Zoom tools to raise your hand. Amy, have you got anyone who wants to make something?
Not as yet, but just whilst we're waiting for anybody to make any comments or raise hands, as it were, I'll just very quickly say there's been a lot of really interesting comments and links and other really interesting resources shared through the Zoom chat. So what I'll do is I can actually save a transcript of the chat and share that with anybody that's interested, or make it available via the Google Doc, so that we can all get back some of those really good comments and links as well.
Fab. Yeah, we'll put it in the Google Doc, and then that'll help HQ, Dave and Ben, when they're looking at what their next part of the work is, that they can start with actual use cases rather than having to talk to us all again. That's good. Okay, one last point from us. If people find this useful, we'll carry on doing it. We're going to send a little survey out to everyone who's done the joined on our Eventbrite or on this. So please let us know. We don't want to carry on talking to ourselves, but we'll have a look at that. You'll get some comms, and we'll feed back to everyone next week. So I am now smack on 45 minutes. Thanks everyone for joining in. Please do join in with the Google document, with the notes, with the data, and let us know how we can help. So thank you. Take it easy, everyone. Cheers.
Cheers, Paul. Take care, mate.
No problem.